Even though today everything's going to be paid at 100%, in January, all of it's going to deductible.
Not all patients are aware about it. They'll be like, oh wow, this will be covered by the insurance at 100%.
Today, we're going to be diving into the crucial topic of copays, out-of-pocket maximums, year-end deductibles. Welcome to this special episode of the Offsite Team Podcast, where I'm here with my good friend April. How are you today?
Good. I've been busy. How are you?
You've been busy. I've been busy too. We're recording this right before Thanksgiving. I do know it's going to drop after Thanksgiving. But today we're going to be diving into the timely and crucial topic of year-end deductibles, copays, out-of-pocket maximums. Typically, it's not year-end deductibles. It's because the deductibles have been met. The copays, out-of-pocket max has been met. Typically, this can be a vital time for high profits for one's medical supply, respiratory store, DME, you name it. So as the year draws to a close, understanding these financial components of your healthcare plan is more important than ever. So let me tell you why this matters. As we approach the end of the year, many of us are looking at our healthcare expenses, and not only our expenses, but the customers coming into our store, and we need to understand the concepts that can save our customers money, but also at the same time really increase the revenue for our business. So today what we're going to cover, deductibles, copays, out-of-pocket maximum, and why they're crucial to starting off Q1 of 2024 on a really good foot plant. So throughout this podcast, we're not only going to demystify these terms, but we're going to provide really practical tips on how to navigate them effectively so you can win with your team, and also so they don't blow up, because they very easily could blow up into horrific beginning of the year deductible problems that can really cause medical supplies to perhaps even go out of business, because out-of-pocket maximums can be hit now, but then before you know it, it will roll into someone's catastrophic plan that might have a $5,000 deductible going into the new year. So hey, that's where we're going today, April. So first, we're going to talk about utilizing sales without a copay. So this is my favorite time of the year, because a lot of times people are coming into Howard's, which is the home medical supply that we oversee with the Offsite team. And I love it because they'll come in to get a CPAP machine, a ostomy supplies, wheelchairs, home oxygen. And we love it because we verify insurance, and they might say, hey, Mrs. Smith has a $500 deductible or even a $2,000 deductible, but she's already hit her out-of-pocket max. So we love this. We don't have to collect copays at the time of service because she's hit her out-of-pocket max. So how easy is it for you and the rest of the Offsite team to close these sales when we've hit the out-of-pocket max?
It's actually very good when we see that, when we run eligibility, especially the out-of-pocket maximum, because when the customers met their out-of-pocket maximum, it means that they're not responsible for anything. The insurance will cover pretty much 100% at that time.
It's great. Absolutely. And so they're coming into our store because they need oxygen or they need a CPAP machine. So they're coming because they need something. And then not only that, do you get to give them what they need? We don't have to charge them. They've hit their out-of-pocket max, which is just amazing. And things I love about this is typically there are a lot of companion sales that will come with this. So for example, someone who has everything's going to go towards deductible, they might get the bare minimum. They might just get a new CPAP mask. They might not get tubing, or they might not get new filters, or you name it, because they're worried all of it's going to go up front. Well, once they've hit their out-of-pocket maximum, as long as it's an item covered by insurance, if we have the right things that are, we have to have valid prescription on file, whatever the LCD states for whether the Medicare, Medicaid, or third-party plan, it's going to get paid. So give me some examples of how you and the Offsite team really utilize this to increase sales for us.
So what we usually do when a patient calls in, they're requesting for, let's say, supplies for CPAP machine. We also have this sales funnel trying to ask them, like, you might need this, you might need that, or maybe they're using diapers or Inco supplies. So we also ask them about it, and since they met the out of maximum, then we actually inform them about it, because not all patients are aware about it. I mean, they know, but not everyone they'll be like, "Oh, wow, that's good to hear." Yes, because it looks like that you've met your out-of-pocket maximum. This will be covered by the insurance at 100%. So they'll be surprised.
And so some things, we have trained the offsite team to do this. So for example, someone calls for a new CPAP mask. Not only are we going in and saying, well, Mrs. Smith, you've called us asking for a new CPAP mask. They're doing that. But they're also checking to see, do they need tubing? Do they need filters? We also will then check, hey, are you a nebulizer patient as well too? Well, if they're a nebulizer patient, we can then also put in a reusable neb supply kit. It's not much, but sometimes depending on the insurance, anywhere between $10 and $32, that can go in there as well too. So a lot of these little things add up really, really quickly. And what we have done is we've trained the offsite team to really help your business utilize these sales. And let's be honest, it's not like we're giving people things they don't need. If someone is a nebulizer patient, you want to be changing those cups regularly so you don't have cooties growing in them and all of a sudden you get even more sick. So it's one of those things. It helps us increase revenue. And it really also helps the customer because we don't want the customer or patient getting sick because they're using old, gross nebulizer cups because they're too cheap. So it's one of those things. The key is we need to add existing business with comparable sales, and this is the best time to do it. The best time to do it is at the end of the year because a lot of times there is no cost because the customer has hit their out-of-pocket max. So what this is, it's a strategic move. So companies like us, you're looking to expand in your market reach. It's going to enhance product offerings. And then what it also does, it partners with comparable sales that will happen. So let's not talk about what's going to happen in January. January, that is like in 2 episodes, we're going to talk about dealing with deductibles. So it's like October, November, December, we absolutely love out-of-pocket max. Our sales, I think, somewhere between like 20 to 30% this year because it seems like people coming into our store have been sicker than typically. So they have lots of medical expenses. That's going to change going into the new year. But what it does is it allows us to have these comparable sales. And so certain items that someone might not choose to purchase when they have to pay out of pocket, they will pay, well, they won't pay, they'll have their insurance pay for it. But this will also lead into next year because they'll use that item and then they'll realize, actually, that item that I got last time, changing the filter really does make me feel significantly better. And let's say even on CPAP machines, we'll use it. Maybe they haven't replaced their humidifier chamber this year. They'll utilize that in October, November, December when the out-of-pocket max has been met versus, let's say, January, February, March when they have not and it's all going to deductible. They won't do something like that. What do you think, April?
Yes, I agree with you. And based on my experience as well, I've seen that there's a lot of referrals that we've been getting when it starts October by the end of the year. That's usually a busy time for us, which is really nice.
Yeah. And so another advantage is we do know this, and the offsite team has been trained to do this. So hopefully, the purpose of this podcast, we're kind of telling you how to do it, but we're also saying you might not have the time. So if you don't have the time to do this, hire some of our offsite team members. They're going to do it for you. And I guarantee you, for every $10 you pay one of our offsite team members, they should bring in a 10x return for your medical supplies. So if you're paying them $10, they should bring in an extra $100 for your medical supply because what they're doing is they have been trained to increase and bring in more revenue for your medical supplies. And this really helps businesses looking to maintain a competitive edge because we're in a very growing and dynamic market. It's going to add existing businesses with compatible sales, and it really leads to a forward-thinking approach that can yield significant long-term benefits. So what are some problems? Let's say you have a medical supply that's not that forward-thinking. What's going to happen if we don't do these sales at the end of the year? What might happen going into the next year? Do you know?
Well, if we lose the money.
Yeah, it's unrealized gains is essentially what happens. Every first quarter, we all know what's going to happen. People are going to come into the store and they're still going to need a wheelchair. they're still going to need oxygen. But we've all had those patients. They walk in, they're like, yeah, I need this widget, and your deductible is $1,000, and it's all going to go towards that. Well, here are these patients. They're coming into our store in January. They've just spent all their money for Christmas presents for their grandkids, and now they're going to skimp on a CPAP machine or skimp on home oxygen. That can be it's going to hurt the patient, but it's also going to hurt our business because we're not collecting that. So it's one of those things. I love December and I hate January. It's like, oh, it's not even Christmas. So how do we deal with that? How do we fix that problem, knowing that December, November are so great, but January is hard?
Oh, well, whenever we deal with patients, especially if it's a rental item, we train them or we educate them. We let them know that this will be covered at 100%, but since the beginning of the year, it will again start kicking. So it is. So just an FYI.
So let's say take that CPAP machine. Granted, the first month is the most expensive. That's going to get covered at 100%. We do let them know ahead of time. Hey, April, I need to let you know you're going to have a deductible next month, and it's all going to go to deductible. So as we've said in this podcast frequently, the biggest source of discontent in the United States today is unmet expectations. So what I have found is, even though today everything's going to be paid at 100%, next month in January, all of it's going to deductible. So we can do, the first thing we can do is let them know ahead of time. I need to let you know,
Correct.
April. Next month, though, you are going to have to pay for this. And what our offsite team does is they're going to give great expectations. We can say, okay, home oxygen, I'm going to use even numbers. Let's say home oxygen is paid at $100 a month. It could be anywhere from 60 up to 140, depending on what zip code you're in. But let's just say, for the sake of argument, it's going to be $100. We're going to let them know, hey, next month, your home oxygen is going to be $100. And this is going to be hitting your account. Our team has been trained to take credit cards on file. We get those signatures. And so we'll just say, hey, April, this is going to hit your account next January 16th in the amount of $100. But great news, today you don't have anything. And no one's excited to pay money, but at least they know next month they are going to have a $100 bill. That's going to, now, and it's been helpful because our team is going to tell them that ahead of time. So they do know it's coming, and we know we take that credit card on file. So what's going to happen, even though out-of-pocket max has been met this year, we know that that invoice is going to drop, and the way Brightree works, or whoever software that you're using has worked, it should automatically bill and get paid unless that credit card expires or something like that. So that's another advantage of working with the offsite team, because you have all these little things that happen in November, December, and then it goes into January and February. So tell me, April, with the offsite team training, how do you teach the team? And I would say, why is our way better than, let's say, another company out there? Because we do know we have comparable companies that we do business against. Why is our way better?
I guess it's because we do extensive training when it comes to offsite team. First and foremost, we educate them what these means, like deductible, co-payment, out-of-pocket maximum, because we're in the Philippines. This is not something that's common to us, but we made sure that, so we made sure that the offsite team knows what it means and knows, we provide them experience on in order for them to best understand, which is why when they started working, they already know, like when they hear the word, they already know what's this for. And on top of that, once that they're fully trained, we also do continuous training because there are updates. Insurance sometimes change deductible year after year after year, so we keep them up to date.
Oh, and you were also alluding to one of the episodes that we're going to record in the next few weeks on New Year's new rules. Drives me nuts. Every year, insurance companies, the rules are supposed to stay the same. Frequently, they're not. Some benefit us and some do not. And that's in a couple weeks. But you're exactly right. We're always training. Now, one of the things that we utilize with our offsite team, we have a back-end messaging feature that all of our team members across all the businesses that we serve, we're talking back and forth. We're not gossiping. What we're saying is, hey, I'm having problems getting this one item covered. They're sharing tips and tricks between everyone on the team, because it's our goal is to allow our team to help your patients get the items covered by insurances. And it's really one of those things. It really benefits your customers, but it also benefits us because it allows us to keep hiring and keep utilizing, because it's one of those things, people pay really good money for their insurance. Everyone deserves the opportunity to get the maximum amount of benefits for the insurance that they've paid into their entire life. They deserve it. So, hey, that's basically, we need to utilize this year's out-of-pocket max. We need to utilize our sales, but also it's going to lead into what we're going to talk about in 2 weeks, help us get ready for next year's deductibles that we're going to have to pay. So, hey, next week on the episode, I think we're we have a lot of team members. Let's just put it that way. But we're going to talk about how we recruit top talent. Because you can just say, hey, we have team members in the Philippines. We have team members in the United States as well, too. But how do we attract top talent? And so next week, we're going to venture into a topic that's at the heart of every thriving business. How do you attract top talent? So in a world where there's competition for skilled professionals, it's fiercer than ever. How do you assure that your company stands out? The number of people who call me and say, oh, I have 3 people, they're warm bodies, but they really don't do as good a job as I would. We're going to talk about how we help utilize our Offsite team to help come alongside you so your business is truly thriving, and how it can be used to transition your team. So next week, we're going to unveil the intricacies of this topic. We invite you to reach out to us between now and then. Why? Well, because next week, there will be an exclusive opportunity that could change the way you think about building your team in conjunction with the Offsite team, because what's going to happen next year, we want to see your business just become more profitable. We want you to work less on your business. We want to have you work less in your business so you can work on your business, and how that expands into 2024. So next week, stay tuned, reach out, and let's embark on this journey, because when it comes to attracting top talent, it's not just about the who, it's about the how, and we're here to show you the way. So in the meantime, go to offsiteteammember.com or reach out to April and I. We would absolutely love to talk to you. But until then, hey, have a wonderful, wonderful day.